Good afternoon. Thank you, Michael. Our healthcare system is broken. The U.S. spends a higher percentage of its per capita GDP on healthcare than any other nation, and yet some of our statistics rank with those of developing nations. PACT, the domestic project of Partners in Health, is working alongside others to transform the U.S. healthcare delivery system and emphasize value-based healthcare. PACT employs community health workers to improve health outcomes among the 10% of patients whose medical expenditures account for 50% of all medical costs. Among a cohort of high-cost AIDS patients, the work of PACT community health workers has resulted in a 60% reduction in unnecessary hospitalizations and a 35% reduction in total Medicaid expenditures. Community health workers accompany patients as they negotiate life with poverty and illness. They extend the reach of clinic-based providers into homes and communities, making treatment recommendations come to life. They address the psychosocial and structural barriers that often are at the root of health disparities. And as community health workers are drawn from the communities they serve, PACT provides employment opportunities where they are desperately needed. PACT is now making a commitment to expand its model to the care of costly patients with multiple chronic diseases. PACT commits to integrate just 25 community health workers into primary care teams across the nation. These community health workers will impact the lives of 2,500 high-risk and high-cost patients, ultimately reducing avoidable costs while improving health outcomes and quality of life. PACT seeks partners who can advocate for healthcare finance reform, lead change within healthcare organizations, and create adaptable systems for maximizing value-based healthcare, an environment where all people, all patients achieve great outcomes at lower cost. Thank you for your attention and support.